Indigenous community. But I'd like to start with saying that one of the iconic reforms of the Whitlam government was the establishment of Medibank, a universal healthcare system that provides access to best quality healthcare and medical services to all Australians, regardless of their socio-economic status. Universal healthcare cover has since become, Deputy Speaker, the Australian way of life, a system of healthcare that is highly valued by our community. Because no one in this country, Deputy Speaker, has ever had to worry about foregoing medical attention, nor have they had to worry about becoming ill or dying because they can't afford to go to the doctor. In fact, Australians, and in particular my constituents, have never had to be concerned about the size of their chequebooks or wallets when it comes to healthcare. That is why, Deputy Speaker, this MPI is very important, because it puts this government on notice that the opposition, together with the Australian people, will fight hard and will fight long to protect our universal healthcare system, because we all believe that access to healthcare for all is a right and not a privilege. Perhaps this government, Deputy Speaker, has not learned from the Howard government's attempts to tamper with Medicare and bulk billing in the past, or perhaps they have learned, Deputy Speaker, as the member for Griffin said earlier on. Perhaps they've learned that if you want to attack Australia's universal healthcare system, you don't let the public know in advance. That is why they deceived the public in the lead-up to the last election by promising no cuts and no new taxes. Deputy Speaker, my constituents are livid at the broken promises and are prepared to fight this government's attempts to change the universality of our healthcare system. Now, in the time that I've been the member for Cornwall, the availability of bulk billing and after-hours GP services, which are a lifeline to the health and well-being of my community, have always been a priority. The proposed $7 GP tax, the $5 hike in medicines, and the $50 billion cut to public hospitals, the $400 million cut from the dental program and the shutting down of 61 Medicare locals is going to have far-reaching ramifications in my electorate. I'm particularly concerned, Deputy Speaker, not only on how the GP tax will impact on visits to doctors, but also on the impact it will have on scans, mammograms and diagnostic imaging. I'm concerned about this because I have a very large multicultural community, an ageing community, and the general socio-economic status of my electorate is such that any additional costs will be a financial burden, to the point where my constituents will be forced to make choices about going to the doctor, choices they have never had to make before. So when the Australian Diagnostic Imaging Association reports that the effects of scrapping the bulk billing incentives on diagnostics will mean that patients will have to pay a minimum of $90 for an X-ray, or $380 for a CAT scan, or $190 for an ultrasound, or a person with lung cancer will have a minimum upfront payment fee of $320, my community and I are very alarmed because, Deputy Speaker, I have an electorate where statistically people are more likely to become ill than those in wealthier electorates. So we can't afford a situation where people can't afford to go to the doctor. I'm particularly concerned about the impact of the GP tax on mammograms. Women in my electorate face paying a minimum of $160 for a mammogram, and especially alarming is the prospect that a woman with a lump in her breast will have to spend at least $280 up front to have her cancer diagnosed. Deputy Speaker, I spend a lot of time advancing awareness about breast cancer in this place, and I know how important preventative measures are because early detection is critical to survival rates. I know how important it is for a woman to have a mammogram, but I also know how difficult it is for many women, especially from non-English speaking backgrounds, to make that decision. We work hard to encourage those women, but I can tell you that the burden of cost will be a deterrence factor. 1 in 9 women get breast cancer. And, Deputy Speaker, when a woman gets breast cancer, a family and a community is affected. Increasing the cost will be a deterrent, and that is just not acceptable. For those of us on this side of the chamber and the Australian public at large, Australia's universal healthcare system is to be treasured and it is to be maintained. It is not to be undermined.